Yeah, I swear a lot, I know. I'm sorry.
I say it's a sign of intelligence. I think it shows a lack of self-control. But what the fuck do I know?
Single
Yeah,
puncture, left
bitch!
ventricle.
Yeah,
You
man!
gotta
Fuck
figure
that
out.
hell!
First unit is in, pressure's up.
Heart is feeling well.
Hola, ¿cómo estás? ¿Dónde está la biblioteca? I'm linguistics, son! I'm sorry. How are you? You good? We're checking out more of The Pitt, episode 3. The show is awesome, I gotta say. Actually, I hate to say it because my friend is right. Damn, don't you hate that? When your friend just recommends something and it actually turns out good, you don't feel glad. You feel angry because why, bro? Why does your recommendation hits, huh? You prick. And you always hate mine. You mother... I'm sorry. Anyhow, let's continue. Oh yeah, we left out with this dude. Every doctor has its first kill. You know what I mean? That's what I learned from House. Another great show. Who saw Dr. House? That was awesome. That was peak cinema. Or TV.
Oh, shit. What? I think I just broke some ribs.
Means you're doing it right.
Third amp of Epi's on board.
Oh, come on.
Call me if there's a resurrection.
Let it go, son. Let it go.
Doctor?
Your kids have any pets?
Oh, my house is like a zoo.
You have a dog?
Ugh, no dogs, no cats. I followed my mother's rule. No pets that can't be buried at sea.
I'm not sure I follow.
You ever try to flush a guinea pig? Try explaining that to your plumber.
Good to know.
I had 2 pets. 1 bird and a cat. Actually, several cats. It took several to realize I'm allergic. It still kills me to this day. Damn, I love cats. But I had a bird called Will Henry. If you read books, and if you followed my channel, I recommended a book called The Monstermologist, right? Read that book, son. It's so awesome. Snap to, Will Henry. That bird shat everywhere, but he was cool. He would do this, and he would come to your finger and everything. It was cool.
Hey, what's up with your asthma guy?
Responding to albuterol.
Okay, one more nabble discharge on prednisone. How's it going out in chairs?
That's fine, I guess. Dr. McKay seems nice.
Cassie? Oh, yeah, she's great.
She been here long?
A little while? Why?
I'm just curious. Do you know what she did before she came here?
What she did? What do you mean, like school?
Oh, like school, work, personal life. I was trying to get to know her better.
Yeah, I don't know. I don't know that much about her. She has a son. I know that. She's a pretty private person. Anything else?
No, sorry, I'm good. Thank you.
Hey, where are we at with opening up some beds? Our Nepali lady with the crushed foot, Manu, she's still in line for the OR?
Yeah, she got bumped by your Lefort-3 fracture. Ben Kemper, he just went up. Still waiting for him to take the electrocution fasciotomy.
What about our OD in Central 7?
Robbie wants a few more tests. He's stable and on a vent.
Is he a candidate for organ donation?
Not sure.
Then why is Robbie keeping him here?
I don't know. Maybe he sees something we don't.
Or maybe he's hoping for something that isn't there.
What's there is an 18-year-old kid named Nick Bradley.
Yeah, is he though? I don't mean to be a dick, but...
You just can't help it?
No, as sad as it is, that kid is gone, and if we get him upstairs to ICU, we're gonna use that bed to actually help somebody.
Robbie is helping somebody. He's
Valid.
helping 2 people, in fact. They're in there right now, praying over their dead son. They just haven't let their hearts accept it yet.
Jeez, it's 9 o'clock. You're already bumming me out. Okay, let's see. Who's up next at the Deli of Death? Weak and dizzy? No thanks. Flank pain, need a UA first, and buttock abscess. Great teaching case for a student.
Don't make me tell Robbie you're cherry picking.
I'll take projectile vomiting in North 5 for 200, Alex. What do you think the chances are it's a demonic possession?
About the same as you going a whole hour without saying something stupid. For Christ's sakes, go already. You're like having a kid I never wanted.
How are you feeling? Any pain, Minu?
तपाईलाई कस्तो छ मिनु कतै दुखेको छ
दुखेको छैन तर पानी तिर्का लागेको छ.
No pain but I am thirsty
Nothing to drink before your surgery, but we
That is
can
interesting.
get you some lemon swabs.
शल्यक्रिया अघि केही नपिउनु मुखभित्र पुस्न कागतीको टुक्रा दिन सक्छौं
धन्यवाद.
Thank you
नानी कहिले जन्मनुहुन्छ?
Excuse me?
When are you due?
How?
यस्तो कुरा थाहा छ.
You can always tell.
बधाई छ.
Congratulations.
Thanks.
Damn. How? She's not even showing. Have you ever known someone like that? I've known like an auntie that does that. She says like, I can tell Bullshit. Bullshit. She always lies. She always lies. She's on that drama. She been on the social groups so many times. Like, like, shut the hell up. We know you extract information. The CIA doesn't do half as you.
How long before we might expect to see some improvement?
It could be hours, it could be days, it could be never. I don't expect anything for a little while. Why don't you guys go get a cup of coffee in the cafeteria, maybe something to eat? I'll have a nurse call you if
I
anything
still
changes
stand
while
by
you're
my
out.
theory.
Thank you. We appreciate
Hire a couple of gangsters in the hospital to put people down. They satisfy their urge to kill, and you get like a clean hand as a doctor. You know what I mean? Like, Tony, take care of it. I got it, boss. You know what I mean? Like, it would add like drama to the whole thing. I just like it. I just like
That-
the theory.
I'm not
And
leaving.
if that's how I'm
Yourself.
going,
I'm gonna get
that's
a
how
cup
I'm
of coffee.
going.
I gotta call Sarah and the kids. Cafeteria.
Straight down that hallway through the corridor and to the right.
Thanks. And I'm sorry if my sister comes across a little strident.
It's okay. This isn't easy.
He's a good doctor.
The parents of teen overdose Lily and John Bradley are asking about the tests you told them about.
Okay, I'll be right there.
What about the rats?
What about them?
They've been caught?
I have no idea.
We'll find out.
Not sure that's my job.
You're in charge of the ER. The rats are in the ER. That makes you in charge of the rats, and I have a strict rule about vermin in the workplace.
Good to know.
I had snakes in my workspace. Yeah.
Could I get your eyes on?
I didn't get them like personally, but I saw like a big snake and I was like, time to leave the job. I worked in logistics in warehouses. You find a lot of weird shit.
Sickle cell crisis in South 21?
Headed that way right now.
ICU's insisting they still don't have rooms available.
Oh, shit. Esme recon for me. Send our electrocution Victor Hunt up there until the OR's ready, please. Thank you. Third Epi on board?
3 minutes ago.
How long has he been going at it?
10 minutes in here, possibly 30 minutes of prior downtime.
Don't suppose you'd let me try a pericardiocentesis
For what?
for practice, in case it's tamponade.
None seen on ultrasound.
This is a teaching hospital.
Not a cadaver lab.
What do you call this?
Damn.
Do you need a break?
I'm fine.
You don't look fine.
Hold compressions.
Still no rhythm.
Okay, Whitaker, I think that's enough.
Oh, it's been 4 minutes since the last epi. 1 more minute, please.
No.
Hey, where is she?
My friend, she's in my car. She won't wake up.
Okay. Okay, Mateo, Bernie!
What's her name? Jenna. Come on, Jenna. Wake up for me, baby.
That's my sister's name.
Pupils
Baby.
pinpoint. I need.
Narcan.
Yeah. Hold her head back to body. Okay.
Narcan. Let it go, bro. Let it go. R.I.P. My
Not
G.
responding to Narcan. We might need to intubate.
Find a room and open a crash cart.
I can't find a carotid pulse.
5 minutes since the last epi.
Okay, that's it.
That's
Hold
it.
compressions.
Hold. Tough pill.
Welcome back. She's okay.
He took his wife out for dinner last night. For her birthday.
Okay, why doesn't everybody take a minute, go check on your other patients? We'll meet back here to debrief with Kiara.
Damn.
Good sport. Where the hell am I? Pittsburgh Trauma Medical Center. Why? Your friend couldn't wake you. Come right here, Jenna.
Came to with 1 spray of Narcan.
What'd you take, Jenna?
Nothing.
You had to have taken something to cause this.
Okay, no, I was just up late studying and I just couldn't fall asleep.
So you took something to help you sleep? We need to know in order to treat you properly, okay? Do you know what
Yeah.
she took?
No.
This could be a sign of something really serious, and we're gonna have to do a lot of tests that you
Okay,
really
I took
don't...
like half a Xanax.
That's not nothing.
It's okay.
Two things. If you work in the medical industry, no judgment. Don't judge because it destroys the confidence between the patients and you as a medical provider. Two, if you're a patient, don't lie to the doctor. Don't lie. Tell them straight up, dog, I took this, I took this, I took this, I took this, because they don't give a shit. Genuinely. I'm telling you right now, they genuinely don't give a shit what you took. They just want to treat you, right? They don't care what you did to yourself. They only care about how to fix you. So be honest. That small delay F's you up. Just a heads up, to my friends out there who partake.
You taken Xanax before? First time. Okay.
Pussy.
Take a deep breath for me.
Lightweight.
Come on, man. You heard Dr. Robbie. Let's take a break. Grab a coffee.
Yeah.
No, I'm fine. Thank you.
You're not fine, bro.
Did you know him?
No, I did. Did you?
Just met him. He was my first patient to die.
I'm sorry.
Are you okay?
Yeah.
You sure?
Yeah. I just remembering the first time that on occasion I have an emotional response to death. It's,
Gotta be kind of tough for a doctor.
at times it can be. At least I'm not a pathologist. I was joking.
Oh.
I have nothing against pathologists.
Yeah, no.
No, screw pathology. I don't know what it is, but they're like, I'm down with the hate. I'm down with the hate. Screw it, bruh. You pathologic ass, bro. Not funny, I know.
The radio density, right below low.
Is it pneumonia?
Possibly. Or it just changes from vaso-occlusion of the sickle cells.
It's called acute chest syndrome. We're gonna cover you with antibiotics just to be on the safe side.
Yeah, we've been through this before.
Third-generation cephalosporin and a macrolide.
Perfect. You're in good hands.
Can I do a chest tube?
Which patient?
Any. I've just never done a chest tube before.
Are you really asking me to reserve any incoming injury requiring a chest tube for you?
Not all of them. I'd be more than happy just doing one, but hey, if you wanted to give me more, I'd be fine with that too, but that's up to you. I'm down for anything.
Confidence and ambition are great attributes, especially when paired with respect and humility.
Okay, what else? What else?
Question. I know. You stop a lot. Let's have fun. If you had the option between a doctor that is very good but cocky, unprofessional when it comes to like bedside manners, but he does his job perfect. I'm talking about he puts in the catheter and he's like, ugh, nailed it. Let's go. I'm the best. And he is. Versus a doctor who's kind, gentle, cares about you, holds your hand as you die, basically. Like, his skill is not bad, but the bedside is just better than the skill. Versus someone who has a lot of skill, but the bedside is very low. Which one would you take? Honestly, I don't need to like you, bro. Just fix me. I want you to be cocky. I want you to be, like, unhumble. I want you to be on your A game when you fix me. You know what I mean? At the end of it, I can high five you as I die. Like, it's rough. What would you do? Not interested, huh? Play, bro. Play.
Okay, good. Does anybody have anything that they wish had gone differently?
In the hall. You should have been on a cardiac monitor. We would have caught the arrest right away.
That's true. But there was no indication for monitoring. And we now know that his abdominal pain was not from his gallstones, but from unstable angina due to coronary artery disease.
Then we should have admitted to cardiology.
We did an EKG. We did a troponin. He had a heart score of 3. Who can tell me what that means?
1% chance of an adverse cardiac event in the next 30 days.
Standard of care is to discharge with outpatient follow-up.
He was your patient.
Smart. You see, this meeting is actually helpful because you're like, hey, everything you did was good. Don't stress. That's actually smart.
Dr. Whitaker, would you like to say something before we all take a brief moment of silent reflection?
He liked Kentucky bourbon.
Okay, good. Me too. Anything else?
I don't know. I just met him. No, he seemed nice. He was married. That's it. That's all I got.
That's me. That's
I
me,
spoke with his
bro.
wife.
That's me, bro. I feel you, girl. I feel you. I'll be doing dumb shit like that every time. Every time. I almost done that at a funeral. I was like, oh shit, he died.
On our way here, if anyone needs to talk about this some more, I'm available.
For now, let's harness some good thoughts here for Mr. Milton. Okay. That's it. Let's go save some lives. Hey, Whitaker. How are you feeling on this?
Effed up.
I mean, not good. I was just talking to him. Now he's dead.
It's the hardest way to lose a patient. Always hurts.
Especially when it's your fault.
This was not your fault. This was nobody's fault. No doctor on the planet could have caught this. Listen, it sucks, but today was this guy's day to leave this mortal coil. 150,000 people die every day in the world, and you got one of them. But you learn to live with it, you learn to accept it as much as your own mortality, and find balance if you can.
You found balance.
No.
No, not even close. But I you keep trying, which is all you can do. You're doing great. Whitaker, just, hang in there.
Yeah, thanks.
He's a good doctor, bro.
I'm just gonna go.
Yeah.
But our social worker Kiara is here if you want to talk.
Okay, yeah.
Okay. You're gonna recover. Okay? Good luck. But wait, what happens now? We monitor her heart and breathing for the next few hours to make sure she doesn't need more Narcan. That's it? Yeah. You should text your friends. How you should text your whole college. Tell anyone to listen to not take pills without a real prescription unless they want to end up here.
Seriously, fentanyl is everywhere. It's in everything on the street these days. How long would I monitor her pupils
you know
for?
what? I actually have to go to the bathroom. Will you carry on your own until I get back?
Absolutely. Take your time.
Okay, great. Thanks. Sometimes I come on too strong.
Excuse me?
It's a defense mechanism against insecurity.
You're kidding, right?
Yeah. But I am sorry if I hurt your feelings. I want us to get along. I want us to be friends. And if I'm really being honest, I want your mother to write me a kick-ass recommendation letter.
You're going into general surgery.
I might. I'm keeping my options open.
You want me to pimp out my mother for something you might
Yeah,
do?
bro. Help a bro out.
Okay, well, when you put it like that, it sounds dirty and a little hot, but yes. In full disclosure, so we can be friends. Friends. You've heard of the concept? Buddies, compatriots, confidants, pals. They even made a show about it.
Yeah?
Boom. Come on. Don't leave me hanging, Crash.
Never,
Shit.
never leave a bro
I can call you
hanging.
that now that we're friends.
Yeah.
Right?
Yeah.
We'll work on that.
Do you blow it up
for the
when you not when you knuckle? Do you blow it up? I actually just and then yeah, I mean yeah. I love that shit. People grow out of it. I don't. I like to create like handshakes to everybody I meet. Like you got to do that. Keep the fun. You know what I mean?
apnea test. We keep him on 100% oxygen, but the ventilator won't be giving him breaths.
For how long?
For 10 minutes, we'll monitor his carbon dioxide levels, and if they come back way too high, then we'll know that his brainstem is not telling him to breathe.
And that means?
That would mean that there's no brain function at the most fundamental level. Princess will monitor him, and I will come back as soon as we know the test results.
Okay.
Yeah.
Okay.
All right, Pete. At that point, even if there is function.
This is Hank.
What happened?
Oh, nothing. We were just framing, and my buddy Joey comes in. He says a guy walks into a bar with a nail in his head, and then he points his fucking nail gun at my head. So what would you do? So I freaked out, and then in the ensuing melee, he fucking shoots me.
Melee?
Yeah, you know, like a scuffle, like a Donnybrook. What, you think because I work construction, not a hospital, I don't have a fucking vocabulary? Tier 1 trauma now?
No, sir.
Whoa, definitely intracardiac.
I gotta tell you, this fucking hurts.
Let's just try and relax and dial down the F-bombs. We have children in here.
You want me to stop swearing? Take the fucking nail out of my heart and please something for the pain.
Stabilize the nail. Hank, we need to cut your shirt off.
Fuck that, you cut this shirt, you're gonna buy me a new one.
You can have your pick out of our lost and found.
Ooh, how did this happen?
Framing nail incident with deep penetration of the left chest.
What does it look like?
Hank, you take medicine every day? Any allergies to medication?
No. Can you give me something for the fucking pain already? Is this a hospital or a vet clinic?
Very soon, Hank, very soon.
You say that to the beagles, too.
Pulse 120 BP, 100 over 65.
2 milligrams of morphine.
Liver GSW is in recovery. Good as new.
Whoa, that looks intracardiac.
Oh, nailed it.
Oh, you got jokes now.
No jokes, just pushing your pain meds, buddy.
Small pericardial effusion, but no evidence of tamponade.
Not yet.
Somebody talk to me. Do I need a priest here?
He's tachycardic with borderline BP. He could decompensate.
Stand by with 2 units, hold blood. Garcia here. Start cardiac case.
Am I dying here and nobody's telling me?
Hank, there is blood collecting in the sac around your heart. You need surgery before your heart stops from the pressure around it.
Well, just pull the fucking nail out!
That would definitely kill you.
I want a second opinion. Where's my fucking phone? I can Uber to Crescent and find a real hospital.
Or I can take him in 10 minutes.
And if we intubate him first?
Sooner the better for all of us.
Great. 120 of sucks, 100 of ketamine. Javadi, you're up for this one.
Really?
Now, let's go. Move.
I can start the stimmy with Mel.
Sounds good.
This place sucks. I will destroy you on Yelp. Nobody's ever coming to this shithole again, I swear to God.
From your mouth to God's ear.
Kiara?
Yo, I know you got like a nail inside of you, but stop being a prick or I will push that nail through. Damn! Hold your place. Understand who holds your life in their hands, boy. Like, I want doctors like that. I want a doctor to be like, who you threatening, bitch? And then push the nail like, oh, it hurts, isn't it? What's up with the threat? Now you scared, huh? Now you want to cooperate, huh? Yeah, learn your, like,
Hi, I'm Dr. Melissa King. Everyone calls me
Hey,
Mel.
son.
Yes, we met.
Right. I wanted to ask you about Tyler, the little boy who ate the marijuana gummy.
He's been admitted to pediatrics for observation.
And his parents?
They're upstairs with him. CYF is going to follow up with a home visit just to be safe, but no police were involved. Don't worry, no one's taking their child away from them.
Okay, that's a relief.
Yeah, the parents, on the other hand, may need couples counseling after this. But I think little Tyler's going to be fine.
Honestly, it's not even the fault of the dad. He took the gummy from the brother of the mom, and then kept it in his pocket. He didn't even use it. Like, the guy just gave it to me. I just pocketed it. You know what I mean? It's not even his fault. Mom's tripping.
Hey with me, Mel.
Right behind you.
Dana, what's open?
Trauma 2.
All right, keep it that way. Our target door to balloon time for stimmies is 51 minutes.
Ambitious.
But doable, as you're about to find out. Let's go.
I love her.
Glottis.
I love her.
Eyes off the screen. Now look down the mouth and insert the tube around the bend.
You stole my med student from triage? How's she doing over
You're
here?
doing pretty good.
Now look back at the screen. And advance through the cords.
Good. Good job.
Thanks.
Pressure's down, 7238.
Effusion has grown. Now with RV collapse. Pericardiocentesis?
Let's get another unit on that infuser.
Prep for thoracotomy. Coming through.
We should get back to triage. Oh, you don't want to stay for this? There were like 30 patients still waiting to be assessed out there. Okay. Did someone say thoracotomy?
Crashing from tamponade.
Dr. Garcia, do you think
Trauma surgery gets left-sided, thoracotomies. ED gets the right if we need to extend.
Glove up, girl. You're on suction.
Let's advance that ET tube to the right main stem, please.
10 blade.
Damn.
That's
Dr. Santos, how do we cut through the intercostals?
through the superior rib to avoid the neurovascular bundle.
That's great.
2 questions to my med students or doctors out there, or nurses. How long does it take for the lingo to actually make sense to you. You know what I mean? Because there is lingo in each job you work in, you know? And it takes a while for it to click. But for medical things, the lingo changes each day. You know what I mean? Like a new specimen, a new thing, a new technique is introduced. So how long does it take for you to kind of click with it? Or are you still confused and you're faking your way through it? Because I feel like most of you are going to be like that. Or at least people like me who are working in places like yours. Second, if you're fat, right? And you have to cut through something. Do you have to do like multiple cuts? Or is it like clean either way? I feel like if it's like fat, you got to cut through a lot of fat, you know, and you got to cut, and then you get to the actual thing. It's weird, right? I don't know why it's funny, but it's funny to me.
Doctor.
Ooh!
Full suction and get rid of this nail before I get poked.
On it. Nails intact. In one piece.
Two forceps. Opening the pericardium.
So fucking cool. Dr. Santos, you and his patient share a common vocabulary.
Yeah, I swear a lot, I know. I'm sorry.
I say it's a sign of intelligence. I think it shows a lack of self-control. But what the fuck do I know?
Single
Yeah, bitch! Yeah, me! Fuck that hell!
First unit is in, pressure's up.
Heart is feeling well. Throwing her horizontal mattress and we're out of here.
Stop the bleed while I sew.
Stemmy's arrived.
You got this?
Just wrapping him up for our delivery.
Mr. Ed Gellin is 52 years young with a history of hypertension and hyperlipidemia, 20 minutes of substernal chest pain, 10 out of 10 with dyspnea and diaphoresis. BP is 152 over 95, currently chewing 324 mgs of baby aspirin.
Okay.
Blood's drawn, second IV started. VT stable.
7 millimeters of
nitro
ST
spray
elevation in the
sublingual.
anterior lead.
These are sometimes called tombstones.
Open up, sir.
Tombstone?
Lift the tongue.
Mr. Gellin, you're having a very big heart attack right now. The major artery that carries oxygen to your heart is almost totally blocked.
That doesn't sound too good.
No, it's not very good. We're going to send you up to the cath lab. A cardiologist is going to unblock that with a balloon and leave it open with a stent.
But I'm still having a heart attack?
If everything goes as planned, it'll be like you never had a heart attack. We're going to put a catheter in this artery right here. We're going to shave the hair with a clipper.
As long as you stop short of a Brazilian.
It's an option we offer. Costs a little bit more. A lot of people's insurance won't cover it.
Don't make me laugh. It hurts.
Deal. Anybody we can call?
My wife?
Already have her number.
Okay, we'll call her. You hang in there. I'll be right back.
Damn, that's always awkward.
Apnea test on that.
Can you check the results?
Not just yet. The blood test needs to go to the lab. Takes a few minutes to run the test. I'll come find you in the room as soon as it's done.
Horizontal mattress in place with excellent hemostasis. Cut here.
Damn, the show really keeps you on your toes.
Towel and away we go.
I spoke to cardiothoracic. They can meet you in the OR.
Good job. Coming through. Well done. Well done. Good luck, Mr. Gellin.
Thank you so much.
You're welcome.
2 saves. Totally awesome.
I just held a beating human heart in my hands.
Yeah!
Celebrate.
We should clean these rooms and bring some more patients back.
Sounds like a plan.
Rest for the wicked.
Coach Stemmy was fast.
Time is myocardium. And there are statistics for door-to-balloon time get reviewed, critiqued, and published online.
Door to balloon time.
That's the time from when they hit our door to when the angioplasty balloon gets inflated in the cath lab. If we keep it to under 51 minutes, we can reverse a heart attack and save a life.
Kinda wish Mr. Milton had a STEMI. Thank you for letting me go the distance.
Let it
on
go,
him.
bro. Let it
I
go.
really thought we'd get him back, you know?
Yeah, well, you know, even though you do everything right, you don't always get what you hope for.
True that. I could never work in a hospital.
My parents both had sickle
I
cell
fuck up a
trait,
lot.
And I was screened as a newborn with
Like
the
a lot.
pattern.
Did you take penicillin?
Mm-hmm.
And if you
Until I
work
was
with
5 and the
machines,
vaccine
a machine breaks. But if you work with human beings, some motherfucker's dead. I can't have that on my conscience.
Yep. Excuse me.
That's why I worked in electromechanical. Let's go coding.
Is there a
My
problem?
coding bros, let's
Being
go.
well-controlled.
You understand?
Nor
that's not the
and
way of
codes,
asking why you
bitch.
spend
Let's
so much
go.
time with one patient.
Arduinos.
You're an R3. As an R3, you should be seeing at least 2 patients an hour.
I have to. Joyce and Mr. Wallace are good Samaritan.
Who's comatose and stable, you should have 4 by now.
I have the highest patient satisfaction of anyone.
I don't doubt it, but we just had this conversation a couple hours
I know
ago.
people call me slow-mo. You don't have to confirm or deny. It used to hurt my feelings a lot, but I can't help it. I work at the speed I'm comfortable at.
Because You're afraid of making a mistake?
I'm always afraid of making a mistake, aren't you?
Yeah, of course I am, but you know what I mean. You make a mistake once and somebody dies and you feel so badly about it, you'll never let it happen.
How is that wrong?
Because you waste time and money on unnecessary tests. You keep sick patients waiting too long. You miss out on cases you could be learning from. You shortchange your own education. I'm not saying this to be a hard ass. I'm saying this because I know you could do this, but you need to do it at a level I also know you're capable of.
And what if I'm not?
Then you should look into a specialty that better suits you. Have you thought about psychiatry?
I don't want to go into psychiatry. I want to be here.
Being here means no matter how good you are or how hard you try, you're going to make another mistake. And someone else might even die. That's called being an emergency medicine doctor.
Yeah. Valid.
If you can't accept that, then maybe this isn't the place for you.
I can accept that.
You sure?
Yeah.
Yes.
I love that I'm talking like I know shit. I don't.
You'll save some lives. Clear some beds while you're at it.
Sometimes you gotta be that confident.
I would fancy a spot of tea at some point.
You want some tea, darling? I'll get you some tea.
Oh, thank you, sweetheart.
Is Dr. Robbie available?
He's with the patient. Can I help?
My father's starting to move.
Okay, I'll let him know. Thanks. Yeah.
Is it good or bad?
If there's no spontaneous breathing, then carbon dioxide levels rise above 60, so 82. Definitely means that Nick's brainstem is not triggering him to breathe.
Well, how can you fix that?
We can't. I'm sorry.
But with rest and time,
This is not something that heals on its own.
there's got to be something else that we can do. Nick is our only child.
Is that test 100% accurate?
It is.
Isn't there anything else?
We can do an imaging test called a cerebral perfusion study.
Then let's do it.
But you have to understand that would be the last test what we would do. If it comes back that there's no blood flow to Nick's brain, it would confirm beyond a shadow of a doubt that there's been brain death, which would mean that he's gone.
Then we wait and see.
Call nuclear medicine, see how soon they can take him.
You got it.
I'll be back in a few minutes.
Thank you.
Damn.
Hey,
Damn.
Mr. Spencer in Central 9 tried to pull out his ET tube and is now in soft restraints.
No surprise there. We need to up the propofol.
And the sister of the dead NBC vet in the viewing room just arrived in chairs.
Can you,
Parker in the family room?
please?
No problem. I'll have Perla and Princess prep the body as best they can for viewing. Any progress in there?
No. Can you also keep an extra eye on Whitaker today?
Oh, I'm already on it. I know he lost his first patient.
Yeah, I just don't want to throw him off his game.
You think this kid is game?
I'm not sure yet. Well, give him a chance to find out.
Copy that.
Pay for a cake.
Myrna, what brings you in here today anyway?
I murdered my husband.
Ah, how'd you do it this time?
I put him through a meat grinder.
Best just to grab one and jump back in.
Yeah, right.
Mr. Fulton in Central 14 just needs a shot of my Lancer for his GERD to avoid eating foods with the words flaming hot in their title for at least a few days.
Okay, thanks.
Central 14.
Yeah. Could I get some Mylanta for Mr. Fulton in Central 14?
It'll be a while. If you want it fast, go check out the employee first aid cabinet.
Where is that?
In the lounge. I'll show you. How's it going?
Not so great. I lost a patient.
So I heard. Also heard it wasn't your fault.
Doesn't make it feel any better.
Yeah, it doesn't. I'm sorry. Unfortunately, it comes with a job. If it's any consolation, I just got scolded for going too slow. If you're someone talking about a slow-mo, that's me.
Guaranteed you're going faster than me.
I like to say it gets easier. Some days it does. I'm sure the rest of your shift will be better. Shake it first. Oh, but make sure the lid is screwed down tight.
Oh, okay.
Oh my God, I had flashbacks to Wednesday night. Bukkake? I know some of you thought about that joke. No, I had flashback about like a screw up like this. Dog. Oh, the cringe always comes exactly 2 a.m. in the morning. You just fall asleep. Your brain is like, hey, remember that shit you did like 3 days ago? It's like, yeah. Is that fucked up, wasn't it? Yeah. Yeah, fucked up, right? Okay, then what? What do you want me to do with this information? Huh? No, nothing. I'm just telling you, bro. You prick.
Oh. Everyone
I
seems
love
to
her.
get along like family.
You see a family,
The glasses
I
one.
see every man for himself. Actually, that's not entirely true. There is some family here. Chabadi's mom is a surgeon upstairs.
Really?
Yeah.
Oh, it must be so nice.
You kidding? I don't know about your mom, but I would not want mine working within 100 miles of me. No way.
My mother passed. She had a very aggressive malignant pheochromocytoma.
Sorry. Unfortunately, my mother's gonna live forever.
No, she was definitely dead. Like, I'm still shaking. No, she was like dead, dead. I mean, I think her heart stopped. Yeah, she was like,
I think she was dead.
Who?
Who she was just talking about.
Oh.
In case you didn't realize, I use sarcasm and comedy as a shield. Or so I've been told.
Thank you for opening up to me.
Mel, right?
Yes.
Well, it was nice talking to you, Mel.
It was nice talking to you, too. You know, I really hope we can be friends.
The facial acting, perfection. It's like the...
Is there anything I can assist you with, Dr. Robbie?
I think we're best on our own right now, thank you.
He keeps trying to pull away.
We're giving him some more sedation.
Why is he so agitated?
He could have some awareness of the tube in his throat, or that he's in a strange place, or it could be lack of oxygen to his brain.
Does he need more oxygen?
He's on 100%. That's as high as it goes. That is his blood pressure dropping.
Is that even fixable?
Normally, yes, with IV fluids, but we now know that that will just fill up his lungs, drop his oxygen even more.
Wasn't there something else we can do?
We
Tony.
can place a long, large IV catheter in his jugular vein down into his heart and administer Levofed, which is a very powerful medicine, constrict his arteries, raise his blood pressure. But that could cause other organ damage, organ failure. I'm really sorry, but each new step is even more invasive, could cause more suffering with minimal benefit.
Bring Tony. Right? Come on. I'm still on that. Like, seriously, tell me that's not cool. To just say, hey, bring Tony. It's time for Tony. Tony Tucci. You know what I mean? Like big Tone. Tone, take care of it, Tony. Is anybody there named Tony? Say what up. Even if it's not Tony, just lie to me. Just say I'm Tony.
Dr. Robbie said he'd be back in a few minutes.
Yeah, he's with the patient, but I'll let him know.
My son is dead, isn't he?
I'm not a doctor, Mr. Bradley, but I do believe in God, and I am praying for your boy with every beat of my heart.
But it was actually bent.
Thank you.
Yeah. Oh, 1 second.
The contrast, the girl that just nothing happened. I woke up, dramatized. Oh, she almost died. Versus an actual kid who, you know what I mean? Like the contrast linguistics of this situation is so deep. That's a hospital for you. You know what I mean? Again, I talk like I've been there like 100
Mr.
times.
Bradley?
Vince?
No, my dad's gonna freak out. No, I know. I just needed to sleep. I thought I was.
Where did you get the fucking drugs?
Who are you?
Did you give them to my son? Did you give my son drugs?
Mr. Bradley, you can't come in here. Mr. Bradley, please, let me
is
help
this?
you
Tell
out
me
of
the
here.
fucking truth.
Security!
Nick's dad. Did you drug
Where the hell's
my
security?
son?
Your son gave me the drugs, asshole. Ask him.
He's dead. And you are a fucking liar!
Damn!
You killed my son! You killed my fucking son!
Your son almost killed me, dog. Chill. Fuck you and your sons. That's my toxic side. I'm sorry. I'll be cursing him out as soon as he left. What the fuck was wrong with him, man? He almost killed. Like, can you believe that? Like, can you believe it? The nerves of this.
There's no scrubs in here.
Yeah, you have to put your old ones in before it'll give you a new pair.
What?
Yeah.
Forgive me, Mr. Milton.
At least he was
Hey.
respectful.
You missed the best action of the day.
I heard. What happened?
Father of the brain-dead son goes after another patient he thinks gave his son the drugs that killed him.
Jesus, how do you deal with that?
No fucking idea. Oh, what happened here? Did we have an accident?
Do you think I'm wearing this by choice?
Was it number 1 or number 2?
I just got some stuff spilled on me.
Was it a bodily fluid? And was it yours?
No, and no.
Oh, was it from when you killed that guy?
Hey, I did not. That guy had a massive MI in his sleep.
Relax, Huckleberry. I'm just fucking with you. Truth is.
Hey, no. There's a line and you crossed. Like, what the hell? Like, I get being a dickhead, that's fine. But that was a crossed line. That's Catch Me Outside. We're doing this. What the hell did you call me? And what did you just say? No, I'm not shrugging this off. I'm escalating. What's up? You think it was funny? You don't think I fucked up? You don't think I'm mad about that stuff, huh? You think this is a game? You playing with my fucking emotions.
You're not a real doctor till you've lost at least one patient. You got off easy. It wasn't your fault. Not all of us can take comfort in saying that. But,
and she recovered. I'm cool with her again.
What am I looking at? Mr. Bill Philbin, 46. He tripped while walking his dog.
He saw a squirrel, and it's my wife's dog. Damn thing doesn't even like me.
Clearly. Where's the dog now?
Hopefully in a kill shelter.
Come on, baby. Oh.
I'm sorry. I just want to understand how this could happen to our son. I
Luck of
can't
the draw.
stop wondering why Nick and not her. I can't help it.
I think it would be helpful for you to speak with our department social worker. Would you two be open to that?
None of this is fair.
No. No, it's not.
But he's still breathing.
The ventilator's breathing for him. Brain death is the same as death.
What about that last test that we're waiting for?
I can almost guarantee it'll say the same. I'm so sorry. I wish I could have done more to save your son. Our social worker, Kiara, is here to help you with anything you might need. She's amazing. I'm gonna go find her and have her come see you.
Go to the dorm, and within a couple minutes, I've never seen anything.
Get Dad sorted out?
I think so. He and his wife are dealing with a lot right now.
No shit, that's a tough one.
Yeah. Do you know where Kiara is?
Not offhand, but I can page her.
No, it's okay. I'll find her. I gotta hit the restroom anyway.
I'll tell her you're looking for if she comes this way.
Thank you.
Yep.
Now I gotta pee.
Kevin, take Marty to pee.
Ask Dana what's open for morphine and order an x-ray, okay?
Copy.
Hey, closed injury, forklift versus foot, forklift 1.
Got it?
Hey, any news on our incel kid, David?
I don't think we've heard from him yet, and I don't know that you should refer to him that way.
Well, he did have a list of girls' names he wanted to hurt. They could be at risk. Are the cops looking for him?
Not sure we're there yet.
Okay. I trust your judgment, and I'm the last person who wants to involve the police in anything. But you don't want to be wrong about this one.
I know.
So what's the issue?
Maybe I don't want to ruin this kid's life.
That's
well,
tough.
you don't want him ruining anyone else's life either. Look, I've personally been on the wrong side of someone who hates women. It's not a safe place to be. Okay?
Any luck reaching David?
Not yet.
Did you try calling the school?
He didn't show up for class.
Any idea where he might have gone? Friends, relatives?
We don't have any family in state. And David, he doesn't associate with anyone.
Another red flag.
Teresa, do you think that David would try to hurt any of the girls that are on that list?
No,
Do you remember some of the names on that list?
not really.
Maybe you could try. How's she doing?
She's worried sick about her son. What are you going to do?
I thought he would come back after Mom called him. Hey, what are the ethics about me reaching out to him under the guise of a medical emergency with Mom?
If he's a danger to himself or others, I'd argue you have a professional responsibility to do whatever's necessary.
Okay. Hey, can you come talk to the parents of the OD kid that we brought in earlier? 18-year-old, brain dead from a fentanyl overdose.
Oh, jeez.
Yeah, only child, and I just think that the parents could use a little help processing what they're going through.
What about donation? Is he a candidate?
The transplant counselor could get him there, but I think we're a ways away from calling them in.
I'll see what I can do.
Thank you. They're in Central 7. I would introduce you, but I really have to pee.
No worries.
Thank you. What the hell?
I just saw one of those rats.
And you thought you started an IV?
It's not funny. You're not the one who's going to have nightmares.
I forgot about your phobia with rats.
It is not a phobia. Nobody likes rats.
Some people keep them as pets.
If you are purposely keeping a rat in your house that is not a pet, that is a sign of an underlying mental health problem.
Okay, if
Valid.
you makes you feel any better, just think of them as cute little Disney mice with a pituitary condition.
Joke all you want, but if one of those disgusting things bites a patient and we get a case of hantavirus, guess who's going to have to answer for that one? Chief.
Aren't they? What was the name of that cop you were talking to earlier?
What cop?
The good-looking one that you were talking to earlier.
How would I know?
Seemed like you guys had...
Stay in your own lane.
What? I'm not even asking like that. I really did want to talk to him about something.
Uh-huh.
Hey, did the exterminator come yet?
Yeah, great. Sometimes he can be so cute. Ain't gonna get us to go through facilities. Said they'd handle it.
What does that mean?
It means nothing's gonna happen until next week at the earliest, unless we get a patient in here with the service cat. Oh, don't forget, you still have the sister of Abbott's deceased veteran waiting for you.
Yes. I'll be there.
Yeah, go.
Hey, been looking all over for you. We need a cardiovert unstable AFib in North 1.
Okay, just give me a sec.
Systolics 90.
Fuck me.
35-year-old architect working on a deadline, vaping nicotine all night, palpitations this morning, AFib at 147. Mr. Quinn, this is Dr. Robbie.
Hello, sir. How you feeling?
Like crap?
When did your palpitations start?
A little while ago.
We interrogated his smartwatch. His heart rate's only been up for 92 minutes.
You understand we need to shock your heart back to normal?
Is it gonna hurt?
He'll be sedated.
It's really gonna hurt.
Mel, 75 of propofol, slow IV push.
How much did you vape last night?
A couple of pods.
Vape every day?
I do, but not that much.
Want to cut back?
I try, but it's just really fucking hard.
How much nicotine is in a pod? Anybody know?
No idea.
40 milligrams, same as a pack of cigarettes.
Wow, 2 packs in one night.
Mel, what's the safe window for cardioversion?
12 hours.
What happens after that?
Increased risk of embolic stroke from left atrial blood clot.
Which he does not have. Mr. Quinn. Mr. Quinn. Okay, he's out. Same cardioversion, 200 joules.
Charged.
Clear. Bingo.
Sinus rhythm. Cycle BP.
We'll monitor for a few hours.
Yeah, let's get addiction services on the case, too. He's gonna need a daily patch of nicotine gum for breakthrough cravings. This one's a bitch to kick.
Hey, the sister of David.
Shit, yes.
Go get him, Tiger.
Damn. Trying to keep all of this shit together in your mind would drive me crazy.
Are you Mr. Worcester's sister?
Fiona.
Hi, Fiona. I'm Dr. Rabinovich. Everybody calls me Dr. Robbie. Have a seat, please. I will tell you everything that's happened.
You looking for something in particular?
Anything with a very low potential for mortality?
Mm-mm. You're not playing that game.
Only thing I'm playing is let's keep the patients alive.
Uh-huh. Well, now we're playing Face Your Fears.
That sounds like a terrible game.
What out there scares you the most?
All of it.
Pick the worst.
South 20, 82-year-old woman, low back pain. I mean, that's potential leaking AAA, caught Aquinas syndrome, spinal epidural abscess. That could go wrong in so many ways.
Not today, amigo. We're gonna work this lady up like a race car.
What does that mean?
Means you're on the pit crew now. Come on.
Being a mechanic and being a doctor are very similar. I pissed off a lot of people from saying that. But it is!
I'll be with you.
You know, I'm thinking about creating a show. Actually, I'm not going to tell you because you may be stealing it. But if you steal it, actually do it. You know what? What if instead of like a medical drama, it's a pit drama? You know, a car comes in and it's like, what do we have? It's a 95 Charger. Oh my God, it lost its engine. Give me electrical battery right now! Don't die on me. Dear God, the radiator. Sir, I know that you love this car, but there's a 67 Chevrolet Impala just waiting for transistor. Sorry, an alternator. Would you donate? Yes. That way it would live on. Like, you know what I mean? Like, dog. But the key is, don't make it funny. Make it serious. Like, I want the doctors to feel the sadness, or the mechanics to feel the sadness of each and every car they lose. That way it's just, you know what I mean? At least give me credit for the show.
You're so cold. I'm sorry. I'm sorry I wasn't here with you. But I'm here now. Wherever you are. I don't know what the world is without you. I really can't look at this letter. Would it be too much for you to ask you to read it to me? Oh, I'm sorry. That's inappropriate.
No, not at all. Not at all. I'd be honored by the request.
Buy milk. Don't forget to change the light bulbs on the lights. Like, that's my letter.
To the family of Raymond Orser. My name is Dr. Jack Abbott. I am the emergency department physician who treated Raymond. I, like Ray, am also a veteran. And though I never met Raymond before today, I served with men like him. So I can only imagine what an outstanding person he must have been. I'm sorry I could not save Ray's life. We worked on him for several hours, but his injuries were too severe. Even for someone as tough and battle-tested as Raymond. Please take some comfort in knowing he did not suffer. You have my heartfelt condolences, Jack Abbott.
Oh, that's his friend who almost off the building.
Thank you.
I'm assuming, right?
Again, I'm very, very sorry for your loss.
Now to the bathroom.
Where do you think you're going, Myrna?
Oh, none of your business, fruitcake.
Actually, everything that happens in this department is my business. And you know what? I put up with a lot around here. I take very good care of you. So you can call me Dr. Rabinovich. You can call me Dr. Robbie, or you can use my first name of Michael. But I do not appreciate you calling me Fruitcake.
Oh, did I hurt your feelings, cocksucker?
That said, it has a certain whimsical quality to it that I could probably learn to live with.
Whatever you say, fruitcake.
Excuse me, doctor. My father's starting to struggle again.
Okay.
Did you know those things will kill you?
Not that lucky.
What the fuck? Hey, they're stealing our rig!
Did you leave the keys in it?
Always, in case somebody needs to move it.
Yeah, you probably shouldn't have done that. Why don't you come on inside, Ziegler? We'll look you over.
I'm fine. Fuck that. You believe that shit?
Happens.
Damn.
What can you do to make him more comfortable?
We can take the tube out.
but he needs that to breathe.
If we extubate, we would keep him on oxygen for comfort. It would decrease his sedation. He might regain consciousness. He could recognize you, maybe even speak.
Well, I don't want to do anything to jeopardize him getting better.
That's just the point, Helen. He's never getting better.
You don't know that.
I do know that, okay? He knows that. And Dad probably even knows it. It's time to let him go.
I'm sorry if you've had your fill of Dad, but I haven't. And I am not giving up on him.
Let it go!
Even if it's hurting him? I'm sorry, but if there was anything I could do to heal your father, I would do it. But the most humane thing that I can do for him is to allow him a painless, peaceful passing. And that requires removing the breathing tube.
How long will it take once the tube's out?
From minutes to hours, but we would ensure that he'd be in no physical discomfort.
Just load him up with drugs, play some music in the background, not Enya. You know what I mean? Nothing like sail away, sail away. No, none of that shit. Some Kendrick, some J. Cole, some beats, something vibey, something like he can go to heaven with. You know what I mean? Like right from the top, hamdulillah. I mean, like let him vibe all the way to heaven. Like, yeah, that's the humane shit. Tony comes in, smoking a hookah, just the con Dios, my friend. Poof, like damn, like dog. Take my advice. That's the best way for medicines. Like I innovate. You just stuck on your please. Some quack doctor. Listen to me, bro. It only takes one of us to change the world as we know it. Anyhow. Another great episode. Loved it. Loved everything about it. We're continuing the show, like I said. So, yeah. Had fun. How about you? Not that much, huh? Got tired of me talking. Fuck you, dog. You's a prick. Love you, though. Have a great day. Enjoy your life. Be healthy out there. You know, hide the body. Kill the Demogorgon. And, yeah, that's it. What, you want to stand in ovation? Leave, dog. Leave. You got porn to watch. You sick bastard. I know you, dog. I know you. Doses.